All right, it's important when somebody has arm, shoulder, wrist, hand, elbow pain to dissociate if the pain is actually localized at the elbow or the shoulder, or if it's cervical radiculopathy and coming from the neck. There was a good study in 2003 done by Weiner, and they did a cluster of 4 tests to determine if cervical radiculopathy was the pathology that was causing pain down the extremity. And they did 4 tests. If 3 out of 4 were positive, they found a 94% chance that it was cervical radiculopathy. If there were 4 positive, it was a 99% chance. So it's a pretty good cluster to definitively tell you, not definitively, but to give you a good likelihood ratio that it probably is pain stemming from the neck. The sensitivity is really poor, so it doesn't necessarily rule out cervical radiculopathy, but its specificity is good, so it is used to determine, to rule in that. So the first test you could do is Sperling's, where you will come from behind the patient. You will have them, let's say that his left side, he had pain down his left arm. You would bring the head to the left, slightly extend it. He would do that on his own. If he reported pain, the test would be positive, and then you would stop. If he had no pain with that, you would apply gentle downward pressure. And then if he had pain with that, he can return back to center. If he had pain with that, then it would be a positive test. So the next one from there, if you lay on your back, would be just a basic cervical distraction test. If pain is relieved in the extremity with cervical distraction and it feels better, the test is positive. So for this, you will just do general underneath the occiput, just your distraction, and then listen to his report as to whether the pain goes away, gets worse, or whatever it might be. Again, if the pain alleviates or comes more central, then it would be a positive test. After that, you'll do an upper limb tension test, or upper limb tension test A. So if it's his right arm, you would bring him into, you would bring him into a little bit of depression. You would extend the fingers and the thumb, the external rotation, and then you would go out following the upper limb tension test, assessing to see if the pain is reproduced, his concordant sign. You could have him, when his elbow's extended, you could have him side bend his head to the left to then tension even more. And again, assessing to see if the pain is getting worse in his arm. And the last one, you can sit up, is ipsilateral rotation. Less than 60 degrees is a positive, with pain is positive. So if it were his right side that he's having arm pain, you would have him rotate his head to the right. So go ahead and rotate your head to the left. Rotate to the right. Look over your right shoulder. There. If he's unable, and look back to the center, if he's unable to rotate his head 60 degrees, then it would be positive because of pain or restriction. Mostly looking for pain though in his concordant sign. So if he reports that he can't go 60 degrees because that reproduces the pain that he experiences, that would be a positive test. So again, 4 of those is a 99% chance or a 99% specificity, and 3 even is a 94, which is pretty good. So that's just a way to dissociate if the pain is cervical radiculopathy or if it is localized tissue damage or the pathology is localized to the shoulder or the elbow or the hand or wrist.